Hello, very good afternoon to all of you and welcome back. We will begin this session with the plenary talk by Dr. Nihal Silva.
Good afternoon, everybody. My talk is called a postprandial lecture. I hope you know what that means. Postprandial means after a meal. So I expect about half the crowd to be asleep, and I will also start fading away. Now, I'll try to make it as interesting as possible. First of all, my name . Okay. My name is Nihal Silva. Okay, and unfortunately, I have lived outside of Sri Lanka more than I have lived in Sri Lanka. Okay, so that's why I'm going to talk about the maternal and child health services in the United States. I am not a United States citizen, but Mr. Donald Trump has told me it's okay to talk about it. All right? Okay. Now you can see that I have a lot of letters after my name, like a little alphabet soup. And most of you may not know what it means. When I see things like that in other people's name cards, I don't know what they mean either. But let me tell you what they mean. Okay? Why is it not going forward? Is there a time factor? Why won't it? It's supposed to be in animation.
So I don't think the animation.
Oh. Something is coming up. Oh.
Now it's moving.
Take time?
No, it shouldn't take time.
Go back.
This
It's
line.
not one below that either.
This one.
Yeah. So now the others have come, but when I press this now, I will get this one coming in. Will it come like in animation mode? You better stay right here so that I can ask you. Huh? Okay.
This one, right?
I'm on this one, right? Okay. All right. So now, MD stands for Doctor of Medicine. A lot of people know that. Some people think it's mad dog. All right. But at the moment, I'm not mad. Okay. MPH stands for Master in Public Health. That's because I have a master's degree in public health. And FACOG means Fellow of the American College of Obstetrics and Gynecology. A long title, huh? Okay. And the college deals only with clinical practice of obstetrics and gynecology. The other one is DABOG, Diplomate of the American Board of Obstetrics and Gynecology, and the board deals only with academic achievement or your academic skills. Okay, so there are two different institutions that give us these credentials. Now, this is the logo of the American College of Obstetrics and Gynecology, and you will notice that there is a mother and child, maternal and child. Okay? Now, how many of you here have been to the United States? Please raise your hands. Only one. Okay. And he managed to come back, so he's a good Sri Lankan. Huh? Okay. All right. This is the map of the United States. Okay. And it consists of a lot of different places. Okay. The United States is exactly 150 times larger than Sri Lanka. To be more exact, it's 149.9 times bigger than Sri Lanka. Okay. And it has a population of 325 million people. Sri Lanka's population is 21 million. Now, you see a little triangle that appeared here in California. That's the size of Sri Lanka compared to the United States. Okay? You see the state of California is about 4 to 5 times bigger than Sri Lanka. Now, the United States Cabinet has 15 members. I don't know whether Mr. Donald Trump is going to increase that number, but he has not invited me as yet. Sri Lanka, the present cabinet, has 45 members. And believe it or not, the previous cabinet had 154 ministries with about maybe 100 ministers. So you can see that there are major differences in the way the two countries are run. Okay? Now, let's talk a little bit about the United States. Oh, I want to tell you one thing more. You see this place here? That's not part of what is called the mainland. It's a little bit to the north, and it's called Alaska. And there are a few islands down there which are about 2,000 miles into the sea on the west side. That's called Hawaii. I lived in Hawaii for 12 years, and Hawaii is very much like Sri Lanka. Okay. Now, let's see what the United States is all about. I'm going to give you an overview of the United States. The USA is not a single country. It is composed of 50 small countries called states, and some are called territories because they have not got this, they have not risen to the standard of a state as yet. Each state is fiercely independent and has its own sets of laws and administration. For example, I am a doctor in California, but if I drive to Nevada for the weekend, I'm not a doctor in Nevada. I am not a doctor in Nevada. I'm only a doctor in California. Okay? So most United States, so-called United States doctors maybe have licenses in 2 or 3 states, but not one for the whole country. There is no such concept. Okay. And so for the nurses, there isn't one license for the whole country. Every state has different licenses. Okay. Despite this, there is a framework where there is some unity and conformity in matters of common importance, such as defense, health, education, infrastructure, transport, immigration, labor law, and a few other related things. But even the civil law is different from one state to another. Okay. What is murder in one state is not murder in another state. You might think it's impossible, but that's the way it is. Now, the central framework that manages and controls all the 50 states is called the federal government. Some people call it the central government. The population of the USA is approximately 325 million and is not racially and culturally uniform. This is a very important thing about the United States. Okay? So people don't react, people don't behave uniformly. Attitudes towards health, childbearing and child rearing, family size, education, religion are not uniform. And although English is the working language, there is no official national language in the United States. English is not the official language of the United States. Everybody in the USA is not equally rich either. A lot of people think, you go to America, you become rich. Not so. Okay. In 2015, which is just last year, 13.5%, that is 43 million people in America, lived in poverty. And poverty is defined by law according to your family size. Okay. California is the richest state in the United States, but it has the highest poverty rate, 23%. Iowa is a smaller state. It has 12.5% of its people living in poverty. And since about the 1930s, measures of health care and measures of poverty in the United States has been much lower, in the sense it's worse than in many other countries. Okay, it's worse. So generally this poor section of society is being served by federal assistance programs. The people who are generally working and are employed, they have the power of being able to buy health care coverage from the marketplace because of private insurance schemes. And these insurance schemes are somewhat regulated by the employer and the government. So a lot of people have health coverage because of that. But there is about 17% who do not have employer-related health coverage. Now, the unit of government that deals with health and related matters in the United States is called the Department of Health and Human Resources, DHHR. It was once called the Department of Health and Human Resources. Separately, each state has got its own Department of Health called DOH. The word ministry and minister is not used in the USA. Instead, it is the department and secretary. Now, about DHHR. Okay. It is a mission of the Department of Health and Human Resources to protect the health and well-being of all Americans. They promote that by fostering advances in clinical medicine, public health, and social services. It has 115 programs across 11 operating divisions, and they serve about 13% of the population, which is about the poverty rate in the United States. The DHHR has 11 divisions, including 8 agencies in the public health service and 3 in human services. Okay. These divisions administer a wide variety of health and human services, and they conduct life-saving research for the nation and protecting all Americans, not only some states, but all the United States. Okay. Now, you may have heard of 2 of the agencies, and these are internationally known, and they set the standards for health internationally. One is called the CDC, the Center for Disease Control. Everywhere in the world, if something happens, the first place they go to for information is the CDC. The next is called the FDA, the Food and Drug Administration. These are internationally known bodies or agencies of the Department of Health and Human Resources. They are the ones who, the FDA is the one who allows medicines to be sold and checks into their quality and price and various other things. Okay. Now, there is a agency called HRSA, Department of Health and Human Resources. Okay. It's called Health Resources and Services Administration. And it is under that division that maternal and child health services are provided. Okay. And it was started in 1912, but under a different name, when poverty in America was even worse than what it is now. They wanted to help poor mothers and the poor families. Okay. And in 1935, it was made into law, and the government took over the function under an act called Title V of the Social Security Act. Now, in 1929, there was a major problem in the United States. It had what is called the Great Depression. And in 1929, America became one of the poorest countries in the world for about 3 or 4 years. Then they recovered. And the process of recovery entailed resetting certain social structures. And one of them was the Department of Health and Human Services, now called Human Services and Resources. And they assigned a certain amount of money to it every year. That's called Title V. Okay, that's called Title V. And in 1935, when they set up this new system of Social Security, Title V was started. And the Title V Maternal and Child Health Block Grant means giving some money. The government decided it will give a certain amount of money for maternal and child health care services. Okay? And that at the moment serves about 42 million people, which is about the number of poor people in the United States. Okay. It is the oldest federal and state partnership. This money is given to all the states. Depending on the size of the state and depending on the size of the population, the amount of money they get is different. And also, every state has to request how much they want and the reasons why they want it. And depending on their poverty level, depending on how much the state is going to put into it also, the government will decide how much of money they will get. Okay. State maternal and child health agencies, which are located within the Department of Health of the state, submits a yearly application, and they also submit a statewide needs assessment every 5 years. That means they decide we want to do this, we want to do that, and they ask the government or the central government for help. Okay. And then the government will decide whether it is worth giving it to them or how much they should give. Okay. So Congress is the word for parliament. In the United States, they don't say parliament, they say Congress. Okay. They have two houses, the upper house and the lower house. Okay. So Congress decides on how much money is given. Okay. And it is determined by a formula which considers the proportion of low-income children in that particular state compared to the total number of poor children in the United States. So there is a formula they follow. And if they give $4 to a state, the central government says the state has to put in $3. So they make the state take some responsibility also. They don't just give the money. Okay? So typically more than 5 billion US dollars are available each year for maternal and child health services. So there are 59 states and jurisdictions, 50 states plus 9 jurisdictions, okay, and they all get Title V funding, okay. And in 2014, about 50 million pregnant women, infants and children, including children with special needs, were given money through these programs. Now, these are the different programs that are available for maternal and child health services. Adolescent and young adult health. Now, they may not be children by definition, but up until the age of 18 they are considered children. Okay? Child health, children with special health care needs, other programs that affect the child over 18 years of life, not only for certain age brackets. Okay? Maternal and women's health, which is a separate entity. Perinatal and infant health, which is also a special entity. Then somebody has to keep records of all of this. The data, the research, the epidemiology branches, and then you have to train people to conduct all these programs. So they have masters in public health programs at university or higher levels, and that's how I got my MPH degree, because the United States government gave me a grant to be a member of this big team. Okay, now let's look at each of these particular areas. Take maternal and women's health. About 50% of all pregnant women in the United States benefit from Title V programs, okay, through a system called Women's Preventive Services. And they mostly do preventive services for pregnant mothers and screenings. They are not doing treatment as such, that is given to the doctors. These are issues surrounding the life of a pregnant woman. Okay? So, preventive services, screening services. Okay. Reducing maternal sickness and death from various causes. We'll get into that later. Then, safety in maternity care. They want to make sure that the mother receives adequate or up-to-date treatment from the hospitals they go to, and whether they have the ability to go to these places. Access. Okay. Now, in Sri Lanka we have a system where the nurse goes out to the mothers, which is very good. In the United States, you really can't do that a lot of the time because of the distances involved. Okay. Mother may be close to 100 miles or 200 miles from the nearest hospital. So the government will make sure that there is a taxi service or some kind of transport where the mother can gain access. There's no point having programs if the people can't participate. Okay, so access is a very big factor in the United States. Also, they want to make sure that these mothers who come to hospitals and who are depending on government services are given the same quality of treatment as those who come with private or individual insurance. There can't be any differences in the standard of care. Okay? All right. Then, where adolescents and young adults are concerned, okay, nearly 3/4 of adolescents between the age of 12 and 17, they visit a doctor for something or other, or a program, one of these programs for something or other, to get their health checked out. These are in schools, in universities, and maybe even some clubs that they join to. Okay, so there are services to provide information to children, as it were, of this age, because they may not want to tell their parents. They may be shy. They may be having no money. So they make these avenues available for them. Okay. One of the present big problems is bullying. Especially young children, they start bullying each other. It's a common thing. It happens even in Sri Lanka. But it is considered something that can be prevented, and therefore there are programs to address that issue. Now this is the area that's closely related to clinical medicine, the practice of obstetrics and gynecology. Okay? Nearly 100% of babies born in the United States, about 4 million every year, are screened for serious conditions at birth. I'm sure it happens in Sri Lanka also, but over in the United States, because of the wide variety of cultures or races, there are a vast number of illnesses that can be discovered early enough in life, that can be treated so that they don't go into a state where they become difficult or impossible to cure. So all babies born in the United States have certain things done. The mother's permission, the father's permission is not required, and it's because they want to safeguard the health of the entire country. So they are screened for heritable disorders, certain things that happen because certain illnesses run in the family. Hearing impairment, a big problem with children. Okay? Then they teach mothers about breastfeeding and how to take care of sleeping babies, which is also a big problem. Babies die a lot if they are not put to bed properly. Okay? Now, these programs involve mothers, and they usually involve hospitals where they give birth. But the money for that comes from Title V funds. Okay. Children with special health care needs. Okay. Unfortunately, not all babies are born perfect. Okay. About 20% of US children are who are under 18 have special needs. Okay. And so they need to have access to high quality specialized medical care and support services. Now when I say support services, these are services that are provided so that the mother and the father will not find it difficult to make use of these programs. So providing babysitters, providing transport, giving their employer notice that they have to keep away from work for half a day or full day or whatever. Those services are all looked at through the Title V funds. And one of the big issues right now is called autism spectrum disorders. It's a wide variety of behaviors displayed by children where they kind of have different behavior patterns. Either they get angry very fast, or they forget things very fast, or they fall asleep easily, which they don't know the reason for, but they are not bad children. They are not problem children. They just need to be handled differently. And so there are lots of programs out there offering magic cures for these things. Do this, do this, do this, come to me, I will give you a good, Thailand or whatever. And so it has to be evidence-based. So that is all monitored by the Department of Health and Human Resources. There are also other illnesses like hemophilia, sickle cell disease, and lots of other genetic diseases that are peculiar to certain races. For example, the Jewish people have a lot of diseases related to the nervous system. Okay, the black people have a lot of diseases related to blood, like the sickle cell disease. There are lots of others also. So these are all looked at and looked after by the Department of Health and Human Resources. And as a result of this, they have family-centered genetic services. So if you have one child with a certain illness that they think is inherited, they have a special division which will counsel that family and their relatives and their children about what will happen to the next generation or to the next child unless certain precautions are taken. Okay? Child health. Now, after the child is born, the child has to fit into society. Now remember, 325 million with so many differences among the behavior patterns of children. So they try to make certain things uniform by having children attend certain kinds of early childhood classes, or play sessions, or picnics, certain kinds of programs to make them interact better with their fellow children. Okay, so there's a program called Bright Futures. Okay. Then the parents are also given advice about positive parenting, and they are getting readiness for entering school, which usually happens at about age 5 or 6. Now, children, you can't make anything child-proof. You can't open a bottle, give it to a child, they'll open it for you. Okay? So, children's safety and prevention of severe illnesses, trauma, or death, or sometimes from accidents, or sometimes from child abuse by parents or neighbors or whatever, sometimes even by dogs. These things happen. So there are programs to look into those things. And there are some programs that cut across all these boundaries, or they kind of cover a lot of areas. For example, immunizations, oral health, reducing obesity, vision screening, promoting proper nutrition, promoting exercise, preventing tobacco and alcohol use. So the state, which has a kind of a program to help these people, it's called Medicaid, and the central government, which has a children's health insurance program called CHIP, they make sure that children at least have insurance, even if the parents don't have insurance. Now, there are some additional programs. One is called WIC, W-I-C, Women, Infants and Children. Now, this is an interesting program because it is done by the United States Department of Agriculture, nothing to do with health. Okay. The United States Department of Agriculture decided they will donate free food to poor people who meet certain criteria. Okay, and it is mainly focusing on newborn babies, probably up to about 2 years of age. Okay, anybody up to age 5 can qualify, but it's mostly in the first couple of years. Okay, and this was made law in 1972 after they had a trial period, and the United States Department of Agriculture thought the program was very successful. Okay, so it is to promote child and family well-being. And they also have certain rules about how much the family income should be, because they measure it against what is called the federal poverty level. Okay. It's a supplemental nutrition assistance program. Okay. Currently, the WIC program serves 53% of all infants born in the United States. So that's much higher than the poverty level if you say 53%. Okay. That's because they even give food to families who have adequate income, but the additional mouths to feed when a baby comes may put a strain on the family budget. Here's another program called Head Start Preschool. This is for children who are about to enter school. They are also given various programs to learn how to socialize. Okay. And it started as an 8-week program during the summer holidays, so that the parents would not have to look after their children and give up their work or be inconvenienced because of work. Okay. And what they found was that it had a tremendous response. So much so that a lot of rich companies, like for example, one of the automakers, one of the aeroplane makers, maybe Bill Gates from Microsoft, they donated millions to make this program work. And how many of you have heard of a program called Sesame Street? You have? Okay. Sesame Street is a wonderful program. When I first went to the United States, I watched Sesame Street because I learned so much about the country from Sesame Street. Okay. And everybody in the United States, it doesn't matter what race they are, what family background they are, they watch Sesame Street. Now other countries have copied it and made programs similar to that. Okay. So they have now even influenced the behavior of not only the low income people but all Americans. So children talk to each other now using Sesame Street language. So that's a kind of uniform kind of language that can affect people's behavior. All right? So now that particular program has been made into law and is funded by private places and also the central government. Now these are some of the other areas in maternal and child health that I did not refer to, but I will just make mention of. Okay. Now these are done under the services called child protection services. I think we have such services in Sri Lanka also. Okay. Now there's a lot of violence, family violence, intimate partner violence, okay, battered spouses, abused spouses, foster parenting, child support enforcement. Supposing you are the father or the mother and you kind of decide to get divorced or not support the family, you are going to get punished by law. So there is a department that looks at that. Okay. Breast milk banking. We all talk about blood banking. There is a service that provides breast milk for premature babies, for some mothers who don't produce enough milk. You go to the milk bank and you get a supply of milk. Okay. Now these are mostly funded by the government, but local agencies, Planned Parenthood maybe, United Way, Worldwide, Lions clubs, Rotary clubs, service organizations like that, YMCA, and rich people. They just contribute. America has a lot of rich people. Pardon me if I begin to be emotional. They give. They don't keep it. They give it. Not only do they give it to the whole world, but they give it to their immediate neighborhood, their church, their school, their clubs, whatever. They are very generous. All right, now, despite all these systems that we talked about, the USA healthcare system falls short in a lot of ways. And the main reason for this is the cultural diversity of the US population. As I told you earlier, it's not a uniform population. Okay? The cultural diversity is getting greater. It's getting more diverse by the day with recent mass migrations from lesser developed countries. Okay. More of these new arrivals are admitted on humanitarian grounds and not because they are got special education or skills, on humanitarian grounds. And when they come to the States, they are deficient in skills, education, resources, mobility, their ability to go from place to place because they don't know the transport system, and even their health and nutrition is very poor. Okay? And many of these recent arrivals fail to mix with the US society immediately, and they fail to make use of available resources due to language, cultural and religious barriers. Okay. So maternal and child health issues like genetic and premarital counseling, prenatal care, childbirth practices, postpartum depression, circumcision, female genital mutilation, breastfeeding, nutrition, immunization, early childhood stimulation, preschool and early education, socialization, TV exposure time, exposure to alcohol and drugs, domestic violence, they are all really highly influenced by cultural practices. So if there are a lot of different cultures within that country, there will be so many different behavior patterns. Okay? Studies show that the health measures of these smaller cultural groups is very low, and therefore these figures dilute the better figures that the richer people and the more educated people will have. So the figures are difficult to interpret. Okay, now here is an idea of the different groups of people in the United States. Okay, 72% are white, 12% are African American, 5% are Asian. At the very bottom it says 16.3% are Hispanic and Latin. Okay, those are the people mostly from South America. Okay, the white people are mostly from Europe. And if you look at the white people, you see the different kinds of people there are. Okay, German the most, Irish the next, African American next, English, Mexican, Italian, Polish. So all these little groups, they live in certain areas. They mix, they talk, they do a lot of things in common. But when they come back home, they have their own culture that they follow. Okay? Now, just 2 more or 3 more slides, please. This is to show what's happening to pregnancy-related mortality. How many mothers die in childbirth? In the United States, you can see in 1987, it was 7.2 per 100,000 women. And right now, it's way up. It's up to about 25. Okay? Now, that's because over the last 50 years, the amount of people entering the United States from various different social levels have diluted the figures. I forgot to tell you one more thing. I left the United States in 1995, and you see that after I left it has got worse. Right? Just I want you to know, that's all. And here is a comparison of other countries versus the United States where maternal health is concerned. You can see that the United States line is going up, whereas all the other countries, the levels are going down. Now, if you look at all these other countries, you find that they are culturally pretty uniform. Culturally pretty uniform. The United States is the only place where it's a real pickle. Everybody is mixed up. And in 2015, their figure was about 25 per 100,000 births. Okay. Now, if you look at the United States alone, if you see that the white race has a rate of 12.5, the blacks have 42.8, 3.5 times the white people's maternal death rate. And the other races altogether comes to about 18%. And this is where Sri Lanka stands. Okay, we have about 35, or now I think it's about 32 per 100,000 births where maternal mortality is concerned. And I want to make another little observation. It started going down after I came back to Sri Lanka. That was around 2008. Okay, that's about all I have to say. Thank you very much for listening.